Welcome to this Fisher & Paykel healthcare presentation on how to fit the Vizero Hospital full-face bridge-free mask. The F&P Vizero mask eliminates nasal bridge pressure while providing an open field of vision. Please note, Fisher & Paykel Vizero masks are single-patient use for a maximum of 14 days. Always refer to the user instructions supplied with the product for a full list of instructions, warnings, contraindications, and explanations. Sizing the mask. Before we begin, please note that the instructions in this video apply to all three mask types. However, we will demonstrate the steps using the Vizero RT077 vented mask. Remove the Size Me sizing guide, which is sealed separately to the mask. Follow the instructions provided on the guide. Place the guide under your patient's nose and match the patient to one of the colored nasal profiles. Tilt the guide upward so that it lays flat against the patient's nostrils. The outline of your patient's nose should fit within the colored nasal profile and cover the black nares. Select the mask size based on the colored profile that best matches your patient's nose. This patient is size A. Fitting the mask. Connect the mask to the flow source and ensure patient monitoring is in place. Undo the lower headgear clips. If the patient has an orogastric or nasogastric tube, place it within the integrated tube fit seal zones to achieve a good seal. Do not pass the tube through the nasal opening in the mask. Ensure that the tape is as smooth as possible on your patient's face to help establish a good seal. Scoop the mask under your patient's nose and slide the headgear over your patient's head. Connect the headgear clips onto the mask. If the seal is sitting on top of the nose, this is incorrect. Ensure that the seal sits comfortably under your patient's nose. Adjust the crown strap to ensure it sits at the center of your patient's head. Adjust the upper straps to secure the under-nose seal. Ensure the straps are not too close to their eyes. Allow a finger-width gap between the headgear and the ear. Tighten the crown strap to move the headgear away from the ear. Loosen the crown strap to move the headgear away from the eyes. Adjust the lower straps to secure the chin seal. Avoid over-tightening the mask, as this may lead to discomfort and leak. Gently pull the mask away from your patient's face to allow the seal to inflate. Removing the mask. To remove the mask, undo the lower clips on both sides of the mask. Gently slide the headgear off your patient's head. By undoing the clips, you should not need to readjust any of the Velcro straps on the headgear. You can keep the upper straps attached to the mask. Refitting the mask. Scoop the mask under your patient's nose and slide the headgear over your patient's head. Reconnect the easy clips. By refitting the mask using just the easy clips, there should be no need to readjust the headgear straps. Gently pull the mask away from your patient's face to allow the seal to inflate. We hope you have enjoyed this presentation on how to fit the F&P Vizero Hospital full-face bridge-free mask. The F&P Vizero mask eliminates nasal bridge pressure while providing an open field of vision. For more information, please contact your local representative about these or any other Fisher & Paykel healthcare products, or visit fphcare.com.